Over 60? If nighttime leg cramps or digestive surprises slow you down, this will help. I'm Dr. Patel, and today I'll show you 3 foods you should never mix with lemon, safe swaps that often ease cramps and swelling, and 2 gentle moves to start rebuilding leg strength. These steps are simple, practical, and grounded in guidance from the National Institute on Aging and the CDC. I'll keep the science short and the tips easy to use. This is educational, not medical advice if you're on medication, have severe reflux, kidney issues, or chronic conditions. Check with your clinician first. Start slow. Be kind to your joints, and I'll walk you through food swaps and chair-friendly exercises that many older adults find helpful. Ready? Let's make one small change today that your legs will thank you for. Right now, why does this show up after 60? Here's the short answer. Muscles change, circulation slows, and tiny shifts in minerals or hydration can spark cramps or swelling. As you age, your body slowly loses muscle mass and power, a process called sarcopenia, which makes ordinary tasks feel harder and increases fall risk. Research and resources from the National Institute on Aging explain how muscle loss accelerates after midlife and why strength becomes a priority for independence. At the same time, public health guidelines remind us that staying active matters. The physical activity guidelines recommend older adults aim for about 150 minutes of moderate aerobic activity a week, plus muscle strengthening and balance work, because that mix helps preserve strength, balance, and circulation. If meeting those numbers feels like too much, doing something is still much better than nothing. Nighttime leg cramps and swelling often come from simple causes: mild dehydration, not enough potassium or magnesium, medication effects, or standing divided by sitting for long stretches. The evidence on magnesium supplements for cramps is mixed. A Cochrane review and later analyses find unclear benefits for routine use, so supplements may help some people but aren't a guaranteed fix. That's why we focus on food, hydration, and gentle strengthening together. Keep safety in mind. If you have kidney disease, heart failure, or take diuretics or certain blood pressure medicines, electrolyte changes, and citrus or supplement choices can matter. Always check with your clinician before starting supplements or big diet shifts. Food and gentle moves work together. When you combine both, the small changes add up to steadier legs and fewer surprises. Let's start with your plate. Small swaps, real gains. When you're over 60 and you love lemon, great. But there are 3 foods that, when mixed with lemon, can become problematic, especially if you're already prone to leg cramps or swelling. And more importantly, there are better swaps rooted in the very nutrients that protect muscles and hydration. First, lemons are high in citric acid. On their own, that's usually fine. But when you mix lemon with very high potassium foods, like big servings of potatoes, bananas, or beans, it can sometimes tip the balance in people whose kidneys or electrolytes are less flexible. Potassium is key for muscle function, and the NIH's Office of Dietary Supplements notes that too much or sudden shifts matter, especially in older adults. Instead of piling on a high potassium dish plus a lemony drink, try more moderate potassium options. Half an avocado, about 360 milligrams potassium, or a modest serving of white beans, lentils, or cooked spinach. These foods give good potassium without forcing your system. Second, magnesium supplements are very common among older adults who suffer cramps, but the evidence says they don't always help much. A Cochrane review found that magnesium is unlikely to significantly reduce cramp frequency or severity in older people. In fact, some randomized trials show only tiny differences versus placebo. Plus, taking high doses of magnesium orally can cause GI issues like diarrhea. So, if you're already getting magnesium, don't assume that adding lemon will amplify the benefit. Instead, aim for natural sources. Pumpkin seeds, almonds, or even a small portion of whole grains can gently support your magnesium needs without overloading. Third, calcium-rich foods are often overlooked, but they, too, play a role in muscle comfort. Calcium helps with muscle contractions, and combining lemon with dairy or leafy greens can be more balanced than mixing it with other high-mineral foods that may compete for absorption or stress your system. For example, adding a little plain yogurt or a handful of steamed broccoli lets you get calcium, plus other electrolytes, without forcing your body to juggle too many peaks. Hydration is the fourth piece. Though I said 3 foods to avoid mixing with lemon, but it's so important, I need to mention it. As we age, our electrolyte balance and fluid regulation change. If you drink lemon water, make sure your meals include mineral-rich, hydrating foods. Watermelon, cooked spinach, or even coconut water once in a while can support electrolyte balance. So, what do you do on a practical level? Here are 3 action-friendly swaps to help stabilize your leg muscles and reduce cramp risk. Instead of lemon plus baked potato, try lemon with a moderate serving of lentils or white beans. Skip taking extra magnesium pills before bed. Instead, include seeds or nuts earlier in the day. Pair your lemon water with a calcium-rich snack like yogurt or greens, and sip an electrolyte-friendly drink if you feel low energy or crampy. These tweaks don't mean giving up what you love, just adjusting how you enjoy it, in a way that supports your body now. Now, let's move together. Grab a sturdy chair or find a wall for support, and let's warm up, gently but purposefully. Start by marching in place for about a minute. Lift one knee, then the other, at a comfortable rhythm. Then shift into ankle circles, 1 foot at a time, rotating slowly in each direction to wake up your joints and blood flow. Once you feel a little looser, we'll add 3 strength-building moves that are especially helpful for your legs. First, seated heel raises. Sit with your feet flat on the floor. Slowly lift your heels toward the ceiling. Hold for 1-2 seconds, then lower. Do around 10 repetitions. Rest and repeat for a second set. If your knees or ankles feel uncomfortable, just lift a little. Even partial raises help, and you can build up over time. Next, try sit to stand, a powerful way to strengthen your thigh and hip muscles. From your chair, lean forward slightly, push through your heels, and stand up. Use your hands lightly for support if needed, then slowly lower back down with control. Aim for 8-12 repetitions per set, 2 sets to start. If full stands are too difficult, begin with partial stands. Stand only part way and slowly return, then gradually go higher as you feel stronger. Our third strength move is wall squats hold. Stand with your back against a wall, feet hip-width apart. Then slide down just until your knees bend a little, maybe 10-20 degrees, into a gentle squat and hold for 10-15 seconds. Then slide back up. That's 1 rep. Do 4-6 reps to begin. If that's too hard, reduce the depth or hold for shorter time. Now, balance work. We'll do a simple but effective drill. Stand near the back of your chair, holding the seat lightly. Lift 1 foot and place it just in front of, or slightly to the side of the other foot, keeping your weight centered and steady. Hold for 10-20 seconds, then switch legs. Repeat twice. If unsupported standing is too much, keep 1 hand on the chair. If it's easy, try without. This helps build balance, coordination, and reduces risk of falls, exactly the kind of multi-component activity the CDC recommends for older adults. To finish, stretch gently. A calf stretch. First, stand facing a wall. 1 foot forward, 1 back. Lean in gently, keeping the back heel on the ground. Hold 20-30 seconds. Then switch. Then a hamstring stretch. Sit on the chair edge. Extend 1 leg out with heel on floor. Lean forward from your hips until you feel a stretch in the back of your thigh. Hold 20 seconds. then switch. Try to do this full mini routine warm-up. Strength, balance, stretch around 2 to 3 times per week, depending on how you feel. If a move causes sharp pain, dizziness, or unusual discomfort, stop and check with your doctor or a physical therapist. Studies show that resistance training in older adults, even moderate intensity, improves strength and mobility. Research from systematic reviews tells us that combining strength plus balance or functional movements reduces risk of muscle decline, sarcopenia, while improving day-to-day function. You don't need a gym, just your chair, a wall, and a few minutes. With consistency, your leg strength can grow, your balance can improve, and the cramps or swelling may ease. Keep listening to your body. Start slow and build weekly. Here's your simple 7-day starter plan. Something gentle enough to fit into real life, but structured enough to help your legs feel steadier and more energized. Think of it as a friendly roadmap, rather than a strict rule book. On Monday, Wednesday, and Friday, set aside just 10 to 15 minutes for a light warm-up, followed by the 3 strength moves and 1 balance drill we've been practicing. Moving slowly and with control is the goal. If a knee aches or a hip feels stiff, shorten the range of motion and let your body ease into it. Many of my patients in their late 60s start with only 1 set, then naturally build to 2 within a few weeks simply by staying consistent. On Tuesday and Thursday, take a brisk walk or choose a gentle cardio activity you enjoy, whether that's pedaling a stationary bike, strolling through your neighborhood, or even a few laps around your living room on days when weather or joints aren't cooperating. 15 to 20 minutes is plenty. Focus on steady breathing and a pace that warms you without leaving you gasping. Small improvements in circulation can make a big difference in how your legs feel at night. Try adding 1 nutrition swap each day. Maybe it's pairing lemon water with yogurt instead of a high-potassium meal, or choosing nuts instead of another magnesium pill. These little choices support your muscles more than you might expect. Track 2 things this week: how many sit-to-stands you can do in 30 seconds, and how long you can balance with gentle support. Write the numbers down today, then again at the end of the week. Most people notice tiny but real changes: 1 extra stand, a few more seconds of balance, and those small wins matter. You've got this. Try these small steps for the next 2 weeks and pay attention to the little wins. Maybe 1 extra sit to stand, maybe a calmer night without cramps, maybe steadier legs when you first get out of bed. Share your 2 numbers in the comments so others your age can see what's possible, and feel free to ask questions or tell me what part of the routine felt best for you. Your progress encourages more people than you know. If you want to keep building strength and balance, my next video walks you through simple footwear fixes and circulation tips that many older adults find surprisingly helpful. Make sure you're subscribed and hit the bell so you don't miss it. And as always, listen to your body and talk with your clinician if anything feels off. You're doing something good for yourself.